Hi, my name is Dr. Raja Adnan Ahmed, and I am a psychiatrist and I work in UK. And this morning I have Dr. Wilson with me, and I arranged this interview especially for the international medical graduates who talk about coming to UK and then moving to Australia, because this is what Dr. Wilson has done. He's a 2019 IMG graduate from India who came to UK using the PLAB pathway. And after working in UK, he has actually got a job in Australia, and now he's moved to Australia and working in Australia currently. So I think it would be good for us to ask him some question and get some idea of what steps are involved in doing that, because I know a lot of IMGs think about it, but they might not have the right guidelines. So Dr. Wilson, thank you very much first of all to give me the time and join me from Australia.
No problem, Dr. Raja. It's my pleasure to share my experience of working in Australia as a SHO or a slash RMO in Australia. I'm happy to share all the experience with you.
So can you just take us through your journey as a doctor so far? I've already explained, that you were a 2019 graduate. So what happened after your graduation and how did you come to UK and Australia then?
So, Dr. Raja, like the way all the doctors plan to come back to go to like different countries like US, UK, Canada, Australia, New Zealand, like the way I started my journey like that. So I completed my internship in 2019
Yeah.
and I started working in India, which was in a mountain region. I worked there for about 1.5 years.
Yeah.
Then where it involved like tackling the ED cases, ops and gynae, general surgery, general medicine, and all sort of things. Then afterwards, I worked about 6 to 7 months in my medical college, which was like a peripheral
Mhm.
hospital. So I was one of the doctors who used to do the on-call duties,
Yeah.
where I used to teach intern doctors as well. So it was a good experience in India as well. but but I would say then I planned, and like in between, I was all planning for my PLAB exam. I took my OET exam in first year of working as a full-fledged doctor in India,
Mm.
where I took my OET exam and then I took PLAB 1, then came to Manchester to take PLAB 2 exam. So sorry about my cough. It's been horrible from last few months. And then I came to Manchester, did my PLAB exam,
Yeah.
luckily passed the exam, the PLAB exam in one go. And then I did 1 month of clinical attachment in Coventry and Warwickshire Hospital, which was in nephrology, which was actually a good experience for me to know how NHS works.
Mm.
So it was a very good experience. I would advise everyone to at least do 4 weeks of clinical attachment. So it was an overview of how I worked as a doctor before coming to UK. Then meanwhile, I started doing my interviews like all the SHOs they do from their hometown. Then I got many offers from different cities of UK. I got it from Leicester. I got it from Coventry. I got it from Manchester. But I wanted to live near to London. So I got it in Reading as well. I
Mm.
never came to Reading before, but it was a very good experience. Then I to work as a SHO in UK as well. So I worked in. I got a job in trauma and orthopedics department in Royal Berkshire Hospital in Reading, where I worked for about I think 16 to 17 months.
Mm.
So I worked there as a SHO in trauma and orthopedics department, which was actually a very good experience for me
Mm.
to work in the surgical field in NHS. And during that time, within the 6th month, I planned that I want to go to Australia
Mm.
to work as a doctor. So
Okay.
from there onwards, with my colleagues, with my friends, I had a chat and we planned. One of my colleague is working in Adelaide Hospital. We both planned to go to Australia. So he's
Mm.
also a RMO.
Mm.
I mean, like you know that in Australia we
Mm.
call RMO,
Yeah.
which is equivalent to SHO.
That.
So he's working in Adelaide here.
Mm.
Then during that period when I was working in trauma and orthopedics department in UK, during that period I realized that I will go to Australia.
So, I mean, I know there's if our audience don't know, but there's a competent authority pathway, which means that if you have done PLAB and then you have done 1 year of experience in UK, they consider it a competent authority, which means that GMC is a competent authority, and that
Yeah.
they can give you registration based on that for AMC. But what was the process when you thought in your mind that I want to go to Australia? What was the process? Did you apply for registration first? Did you apply for jobs first? What was it like for you?
So, for a competent authority pathway, you like all the doctors are eligible, whosoever has worked in UK for at least 1 year,
Mm,
and which is a supervised working.
mm,
Like at least, I mean, Australia wants like the APRA, they want like you are being supervised while working as a doctor in UK. So basically, you have to get at any level, you have to get 1 year of experience in UK, and doesn't matter, it's SHO, it's registrar, it's FY1, it doesn't matter. So the first process is to apply for AMC number, AMC candidate number. So through AMC candidate number, you have to, this is regarding like while you are applying for competent authority pathway.
yeah.
So AMC candidate number, then and the next step is what I did is to apply for jobs,
Mm,
because in Australia you can't get a registration without a job. So you have to have a job in Australia which can say that yes, you are being hired as a RMO, and through which you can apply the APRA registration. So once you get a job, from there onward the process will start.
mm,
Every single process will start once you have the job. I mean, you can always have a AMC candidate number,
mm,
which every doctor can do, but most important thing is to get a job.
mm.
So the real thing starts when you have a job.
So this job, is there a website a particular website, or are they applied on multiple websites? How do you now find those jobs?
So there are different ways where you can get a job. There's a the very good pathway is like to go through LinkedIn.
Mm,
You can get a LinkedIn subscription premium, like there you will get so many jobs. But there is another one, another website called Seek, SEEK, Seek.
mm,
From there onwards, also from you can apply so many jobs. But what I did, I also did apply directly from the hospital website. So apply directly through the hospital website.
mm,
I was, I mean, it's similar to the NHS profile.
mm,
You have to build your CV, and you have to make a big cover letter which says that you're a doctor who has worked in UK and you are eligible for a competent authority pathway. Because I think most of the people here in Australia as well, they don't know. Like, yes, there is a pathway like competent authority
okay.
pathway through which UK doctors can come. Very few people know that. So you have to elaborate that you how you are eligible for that pathway, and you can apply the APRA registration.
Yeah.
So they can give you the job. I mean, like you through looking at your CV, like how you approach them, like the same way we get the NHS job.
Mm,
And from there onwards, you have to start your process. Once you get the job,
mm,
I mean, there are other things also. There are many agents also through
yeah.
which our
Yeah.
junior doctors can get a job. So there are many agencies, there are many agents, but you can also apply directly
Mm,
without, because this agent won't charge any money,
mm,
and you can apply directly through Seek, LinkedIn, through the hospital websites. There are many vacancies through hospital websites,
okay.
so you can apply directly as well.
So the process of job itself. So you applied. Did they interview you? Then interview. Is it the similar interview what you do in NHS?
I think it's very similar. I think it's very similar interview. They will ask you all sort of things, like your background, how many years of experience
Yeah.
you have in as a doctor, and what all procedures you can do. Suppose if you're applied for surgical jobs, suppose I did for trauma and orthopedics job, they asked me all sort of questions. Doctor, can you do the on calls
Mm,
as an independent RMO? Can you do the procedures like aspiration of knee?
mm,
Can you do manipulations? Can you do reductions of the dislocations? So all sort of things they will ask you. So yes, if you have done in UK, you can tell them. But if you haven't done, it's okay to tell them, because they are not looking for a very big level like a
Yeah.
consultant. They are looking for a safe doctor who can come and you can initialize the process. You can just see the patient and make sure the patient is in safe hands. That's it.
Mm. So then after you have got the job, so you apply for AMC. What does that involve? What kind of documents AMC asks for?
AMC, I think they don't ask so many documents. They just ask you to fill up a like some kind of a form, and they will ask your degrees and all, and you have to pay a fees. Basically, I think it was about £300, £350,
Okay.
and they will give you the AMC candidate number. And that AMC candidate number you can have save it with yourself. Then the hospital will send you the APRA form, like it's called APRI 31. I can't remember what, but they will send you some form
Yeah.
which they will fill. Well, like certain bits of the form they will fill, and
Yeah.
certain bits of the form you have to fill. So they will assign a principal clinical supervisor.
Mm.
That clinical supervisor will sign, and you have to fill your bits, like where did you work? Did you work in India? And when did your license started in India? When did it started in UK? When all sort of things they will ask you. Like I think, what have you done? Have you had any criminal history? Those sort of things. So
Mm.
they will send you everything, and the hospital will guide you through each and everything through the APRA thing.
So then APRA form, then you submit to AMC for. So how do you get registration actually? You have to submit that to AMC then after.
So if you get the AMC number
Yeah.
and you get the forms from the hospital, that
Yeah.
is APRA forms, you have to fill your bits. Then all of these things, and one more thing I forgot to tell you, you have to get some police checks as well for the it's called ACRO. You have to get a police check for the APRA registration.
Mm.
And these police checks, all of these things, and you have to submit all of these things to APRA.
Mm.
Then APRA is the equivalent organization, which is like GMC in UK, which will give you a registration. So
Okay.
all of these things you have to submit to APRA.
And what was the registration fees? Is it just £300 you said, or is it more than
I
that?
think for AMC it's about £350,
Yeah.
and for submitting for the application process
Yeah.
for APRA is I think it's about 600, some 500 to £600
Okay. And
for the APRA.
does it take long time or after getting a job to get the registration actually the.
I think it varies from candidate to candidate. Generally, it takes about 2 to 3 weeks, but
Okay.
in my case, I think it they took about 4 weeks. It varies from person to person.
Okay.
So, but they give it very straight away.
Okay. So now you got the the AMC candidate number, then you got the job, and you got the APRA, and then you got the registration. Then afterwards, is your visa thing. How did you actually move practically from here to Australia? Did you apply for visa after that?
Yeah, so there's a visa called a 482 visa, which
Mm.
is like a short-term skilled worker visa, which is
Mm.
similar to what we apply in UK. So the hospital will arrange a nomination number for you,
Mm.
which is like a COS.
Mm.
So they will give you a nomination number. That number you have to fill to the Australian 482 visa. When you go to the Australian website
Yeah.
for applying the visa, you will get that for 482. You have to type 482, everything will come. And one very important thing which I forget to tell you is the health checkup,
Mm.
which the Australian visa people they will ask you, and which you have to get it from certain clinics only. And there are a couple of clinics in UK which you
Like
can get it,
like occupational health
like the
kind of.
yeah, but it is more than that.
Mm.
They will do chest X-ray. TB is very important. They will do chest X-ray, and they will do. I think for Australian thing, one thing was very important, which they actually asked me,
Mm.
which was like, did you have any kidney disease? Because if you have a kidney disease, they it's very difficult that they will give you a visa, because I don't know what but this is what I came to know from my doctor from the clinic who was doing the visa
Mm.
health checkup. They said, like, if because Australia thinks that if you have a kidney which is not working, they don't want to like give, like they don't want any person coming with the issues of a kidney
Mm.
disease. So, but which I think most of the doctor, they don't have that issue.
Mm.
So I think that should be fine.
And then once you got the visa, you applied for like got the sponsorship and all that. So you applied to the Australian embassy in UK, the visa.
Yeah, I applied. It's all online.
Okay, online. Okay.
Australian, yeah, they don't take your passport.
Mm.
They don't take your passport, so it's all online. You can apply from UK, you can apply from your home country.
Mm.
So they will. I think the visa process is a big hassle. They take about like 1 to 2 months of time.
Okay.
So that is a big time. Like they took about 45 days for me
Mm.
to give the visa.
And then you will then move to Australia. Obviously, you will have to find out the starting date as well from your hospital.
Yeah.
Uh,
Yeah, they generally they're very flexible. They can
mm.
give like if suppose your your date is starting with the 10th of October, you can ask them
Mm.
I can I come about like 20th of October or maybe 30th of October. You know, they are
Mm.
very flexible. You can come
Mm.
and you can change the date as well.
So once you are in Australia, I mean, obviously you have now started as well. So did you have induction like similar to what UK has, or in the health system, similar things you have been seeing?
So so basically, it's Australia. I mean, like the system is very similar
Mm.
to UK. But what I have felt, they haven't given any sort of like a proper shadowing. In
Mm.
UK, I had a proper 2 weeks of shadowing because
Yeah,
they know that I am from India and I'm not from the similar system.
yeah,
And they gave me a proper 2 weeks of shadowing. But now they know that I'm not from India. I've
yeah,
worked in UK
yeah.
for a while. So they haven't basically given me a proper shadowing. They just told me like you get your passwords, you get your things, you just see for 2 to 3 days,
Mm.
then you just start working. So I think it's my second week,
Mm.
and they have just told me you can start working as a doctor now, and I think there's no such
Yeah.
thing like shadowing now. If they know that you're from
Yeah, from
UK.
UK, yeah. And in terms of the salary, I'm not sure if you had received the salary, but generally comparing it, is it similar to what UK doctors at the junior level earn, or is it because I know at the senior level is difference. They earn a bit more
Yeah,
in Australia.
yeah, definitely. So I think at a at my level, they I don't think so because I think the salary has been increased in UK.
Yeah.
So now that I think the salary, there is not much difference of a salary now.
Mm.
I think now my salary is like 100,000 Australian dollars,
Yeah.
which is like a base salary,
Mm.
and starting with the 38 hours a week. But
Yeah.
obviously, you work more than that, like they will give you. But the good part is like the locum money is good in Australia.
Okay.
They give you, they pay you very good the locum money.
Mm.
But I don't think so. Like being a SHO, the salary is
There's a
there is a
difference there.
there's a huge difference of salary. I don't know. I know like the being a consultant, there's a
Yeah.
big I mean like not a big, maybe a slight difference of salary, but I think being a SHO is more or less same.
Okay. And if things like finding accommodation, because in UK a lot of people struggle to find accommodation and stuff like that. Did you have the same problem renting and all that?
So so basically they gave us uh relocation allowance. They
Mm.
gave us about like 5,500 Australian dollars relocation allowance. So we just booked through booking.com for
Okay.
1 month. So we booked an apartment
Yeah.
because we know that the hospital will pay for us.
Yeah.
And I think it's similar sort of thing, but I think in Australia, finding an accommodation is more difficult than UK because
Okay.
there is actually a problem with accommodation here.
Mm.
Because I never saw like in UK when you start seeing a house, there are like uh, 10, 12 people coming behind you, but here you can actually see a line.
Yeah.
So
Okay.
there is actually
Yeah.
actually a housing crisis here.
Then, I mean, I know you were recently started, but how did you find the difference in the system when you're working in practically working in hospital? Do you find it similar to what you have done in UK, or is it like a shock to you, a cultural shock or something?
I think it's very similar, I
Mm.
would say, but the system which they use in for the computer is actually more efficient.
Mm.
They use everything, even for follow-ups. They have a computer system, and computer like through computer only the message will be given to the patient. But I think I don't know about other trusts, but the trust where I worked in,
Mm.
like you actually have to call the admin team to arrange the appointment. But I
Yeah.
think the here the system, everything is on the computer. Everything is on the computer. So I think it's not a big shock for me, especially because I
Mm.
have worked in UK. But definitely, I think what I have felt in Australia is about like they don't because they don't give you general registration here.
Mm.
If you're coming through a competent authority pathway, they give you provisional registration,
Yeah.
which is what they say, like you have to work for 47 weeks, then your clinical supervisor can assess you, then send your application to the APRA, then the APRA will give the general registration.
So
And
initially you
that's
were
the
working
thing.
under supervised, for 1 year. The first
Yeah,
47 weeks is about a year, isn't it? 52
it's
weeks is a
it's
year.
about an it's
Yeah.
about a year, and you
Yeah.
are working under supervision, which is I think it's good because I think in UK they give you general registration, and but
Yeah.
they I think the duties are not like they don't just give you duties. They assign you duties which are not uh like not very busy, like which are like
Mm.
they don't give you on call straight away. But in UK they just gave you straight away because I felt overwhelmed in UK. But
Yeah.
I think in Australia I didn't feel like that.
Okay. And the annual leave allowance and study leave are the similar things which you find there.
I think it's similar. I think it's similar. I think it's
Mm.
4 weeks.
Mm.
And I haven't asked about study leave, but I think it's very similar to UK because the culture is very similar in Australia. But just I think just the weather here, the sunshine is good.
Mm.
I think,
Yeah. I
but
think
yeah,
you
the
have gone
sunshine
in
is
the
the
this is the opposite, isn't it? So you've gone in the we have winter very cold weather here right now. So
yeah,
you
yeah,
are in Australia, which is hot. So it will change when we have summer. You will have the winter, but it's probably not
winter.
as harsh as what you see in the UK. Hopefully not.
Yeah, yeah, yeah. I
Yeah.
think the winters are not very harsh here, but
Yeah.
I think I now I coming from UK, I do miss gloomy weather. I don't know if that's right or wrong, but you definitely miss UK.
Yeah.
When you come in Australia, you because there's a pub culture. Even if you don't drink, there's a food available in pub. You can
Yeah.
eat fish and chips. But I kind of like that that culture.
Yeah.
But here it's like people go to beach and they swim in beach and all.
I think it's an adjustment phase. Whenever you move somewhere, you initially you will move like you will miss the place you come
Yeah,
from and all that. So, but I think your time adjustment
the
will
first
happen as well.
yeah, the first day when we both came to Australia, we were like, "Oh my God, it's nothing here." Like the roads are so big, and the population is also very less.
Yeah.
And we actually thought, "Oh, shall we just go back to UK?" Because there's a question mark like why you came, because in UK we were already adjusted to the system,
Mm.
and we know the buses are good. Even the buses from one city to another city, they were really good in UK.
Yeah.
But here I think the timings, they're not as good as UK, but it's just a country which is big. You
Mm.
can't go from one city to another, you have to take a flight.
Mm.
So
So, which part of Australia you are living currently?
so I'm living in Canberra, which is like a capital city of Australia.
Okay.
So I'm living there. I'm working in their tertiary hospital
Mm.
called Canberra Hospital, and they have a three. I mean, that Canberra Hospital is under ACT Healthcare,
Mm.
which has three hospitals under it.
Okay.
I think they don't have trust kind of thing. They just have an organization under
Mm.
which the hospitals work. So
Okay.
one is I think Canberra Hospital where I'm working, and there are another two hospitals as well, and there is one private hospital as well.
Okay. That's good. I'm sure you're planning to apply for training as well afterwards. So, have you explored the training pathways and how do you understand them, or you're still
Yeah.
in the process of understanding them?
So yeah, I'm planning to go for GP training here in Australia,
Yeah.
and because I like GP training because I think it's short and it's
Yeah.
very easy to get for an IMG,
Mm.
especially people like us coming from a different place.
Yeah.
They can get GP training quite easily as compared to other specialties, especially like surgery, orthopedic surgery, general surgery,
Mm.
and even medicine. So I think GP is this is the thing which I want to do.
Okay. That's
So
great.
I've thought of doing GP training here in Australia.
That's great. I think thank you very much for sharing the experience. So at last question was that would you recommend this to the IMGs, then people who are working in UK to explore this? Because I know this is something that a lot of people ask, but they also find a bit of reluctance. Is that a right step to take?
I think this is a very good idea. I mean, we all should definitely try. We should not
Mm.
regret ourselves like, oh my God, I didn't see Australia. At least I would say come here on a tourist visa, see Australia. If you like Australia,
Yeah.
definitely start working. But if you don't like it, I think UK is also a good country. It's a very
Okay.
good country to work in because only you came about you will come about UK only when you come to Australia because the places are very far away in
Yeah.
Australia.
Yeah.
But in UK, the places are very near, and I think I would definitely recommend, but I would recommend to come on a tourist visa and see
Yeah.
how Australia
Mm.
is. If they like Australia, definitely work here.
Sorry, one last question I forgot to ask you about did your visa restrict has any restrictions? Like they say that sometimes the IMGs initially get visa which is only for rural areas, not for big cities, or it's only for the areas of need where you can go. So was there any restrictions when you're applying that you can only apply for that hospital and not to a certain hospital or area?
I think I didn't hear you in between. The voice got
Uh, no, I
There was a
meant
voice
did
break
your
in between. Can you repeat it again?
did your visa have any restrictions? Because they say that when you first apply in Australia, you can only work in certain areas, not everywhere. Was there any restrictions on you when you were applying?
No, I don't think so. There is any restriction, but just one thing which I want to mention is
Mm.
like there's definitely a restriction for a GP, IMG
Okay.
GP,
Yeah.
who is a IMG,
Yeah.
and that is called a 10-year moratorium.
Yeah.
I don't know most of the people they know that or not. I know GP is a very good branch and it's very easy to uh, get GP everywhere in UK or in Australia. But one thing, there's a catch in Australia, like there is a 10-year moratorium where you're only allowed to work in regional cities, like even Canberra is also regional.
Okay.
Perth, Canberra. Apart from Melbourne, Sydney, and Brisbane, every city in Australia is considered regional. So, starting from the day of your APRA registration
Mm.
till when the 10 years are completed, that is called 10-year moratorium.
Okay.
So, people also do this thing. They get APRA registration, they do work as a junior doctor in Australia,
Mm.
and sometimes they don't like it or they want to escape moratorium. They go back to UK, they do GP training, they work there for 2 years as a GP, then they come back to Australia because there's a pathway through which you can come back to Australia as well as
Yeah.
a GP if you have
Yeah.
done GP in UK. So
Yeah.
by that time they would have finished half of their moratorium. So
Mm.
this is what people also do this. So
Okay.
there's a 10 year of moratorium in Australia,
Okay.
but not on RMO level.
Not at a junior level. Okay. Thank
Yeah,
thank you very much for sharing your
no
experience.
problem.
I think it will
It
be
was
well.
nice. Yeah, it was my pleasure to talk to you.
Thank you again.